Good morning everybody, it's delightful to be back here in Cork and Kerry after spending a little time out supporting a family member with an urgent medical problem. And I'm talking today from Marymount University Hospital and Hospice, and again, what a great bunch of people they have here providing great end-of-life care to our community and also providing some really strong older people's care. And I'm here to talk about how we might improve stroke care for the region. But I've just had a bit of time to reflect on some of those things I said that I'd be working on with you when I started this job. So I wanted to work on service quality, I wanted to work on value for money, I wanted to work on population health, on improving staff experience, on equity of services, and on making sure that we don't contribute to climate change. So just thinking about some of the service quality issues, I've been working very hard with colleagues around unscheduled care, and I've been using the bank holidays and other days to go into the emergency departments and around the hospitals, looking at some of those opportunities that we can take to improve care of people who need us in an urgent or emergency situation. And there are many things that we can do, and I've been working very hard on those, and that's been reflected in some much better care for people, particularly moving people off corridors, moving people off corridors in the emergency department, moving them into more comfortable spaces, making sure we deliver better care. That's been a really strong focus. So we have an unscheduled care plan that's in development, and I hope to be able to get that out to you soon. There's some very simple things that we can do together to improve that side of our work. Alongside that, the scheduled care plan is coming together well. We know we've got some people waiting for inordinately long lengths of time. We looked in particular at back pain. Back pain is really interesting because people are referred to a variety of places, and in fact the longest waiting list for our services is with neurosurgery, with a very tiny proportion of patients referred with back pain to neurosurgery actually going on to have surgery. So we know we can put some much better clinical pathways in place using advanced practice physiotherapists to see those patients, with a tiny number then needing to have surgical care. So if I come on then to value for money, we know we're going to be asked to improve our productivity. We have some specific targets to improve productivity. We'll be working with you on those. And by productivity, what we're talking about is the best possible outcomes for our patients, given the resources that we're using to deliver. So the next thing would be population health. So a lot of work on looking at habilitation. I've just been in a conversation about stroke and really emphasizing the need for habilitation to keep people well, looking at smoking cessation, looking at nutrition, looking at exercise, and then looking at some of those preventative services that we can put in place that prevent people having stroke and us having to bring them into hospitals for hyperacute stroke work. So the next thing would be staff experience. I'm really troubled by the fact that we have so many people who are not able to work because they are ill. So I've been working very closely with the management team around this and looking for how we can support your well-being at work, and there'll be some more actions coming out of that. Equity remains an issue for us. I still need to work more with colleagues around the people in our communities who have the least good health outcomes, so in particular the travelling community. And then climate change, I'm beginning some national work on climate change to make sure we contribute as little carbon to the atmosphere as possible. So having said all that, one of the big things we've been working on as a leadership team is our culture. Our culture as a leadership team, and by that I mean how we do things around here. So we've been starting to design some of those behaviours around our core values of care, compassion, learning and trust that will demonstrate to you that the leadership team can be held to account for living those values. So that work will continue, and it will be expanded in the autumn and then come out to the rest of the organisation in early 2025. So thank you all again for all the hard work that you're doing every single day, and I look forward to coming and seeing you soon.